So good afternoon, everyone. So my name is Natacha Stevanovic-Fenn, and for the past decade, first I should say I'm a sociologist, so thank you, Niraj, for promoting our discipline. So for the past decade, I've been working on issues related to gender, sexual reproductive health, and violence and rights in developing regions. And I'm here today to speak on behalf of the Institute for Reproductive Health to highlight some of the key issues we work on. So I thought that I'd start with a story, and that's the story of Sarah, a 15-year-old girl living in Kinshasa in the Democratic Republic of Congo. And at school, a 19-year-old boy she really likes tells her that he's gonna give her a smartphone if she comes over to have some pastries with him. She does, and they have unprotected intercourse. A few months later, she realizes she's pregnant, and she can no longer hide it from her parents, who decide to take her out of school and to marry her to the boy. She now later has a child and has no chance to return to school. So we all know that Sarah's not alone. We have today an estimated 21 million girls aged 15 to 19 and 2 million girls under the age of 15 who become pregnant in developing regions. And most of these are unplanned and unwanted. Why Sarah's story? Well, this is at the heart of IRH's mission, which is to design and implement evidence-based programs to address these critical issues, to advance gender equality, but particularly as it relates to adolescent and sexual reproductive health. So one of IRH's hallmarks is to translate scientific data into really practical guidance for programs that address issues of adolescence. And we're doing this right now under our currently USAID-funded project called Passages, which seeks to understand how social and gender norms influence adolescent reproductive health and gender-based violence in West and Central Africa. We've advanced understanding of social norms through our Learning Collaborative, which is a group of experts who work together to facilitate collaboration between a wide range of organizations and also individuals, experts working on adolescent and youth norm shifting interventions. And together we look into what norms are, how to measure them, how they influence behavior, and most importantly, how to scale up effective normative interventions. And so in this effort, and with support from USAID and the Bill and Melinda Gates Foundation, we've developed a participatory tool called the Social Norms Exploration Tool, also known as the SNET, which is a really simple and cost-effective tool. So now, how do you use it? Well, say you're a program implementer who wants to address adolescent pregnancy in Sarah's community. The SNET would help you identify where and how to focus your program. And so a starting point would be first to identify the behaviors that are most important to achieve your intervention's objectives. And for Sarah, this could be, say, the absence of communication around sex and reproductive matters with her caregivers or parents, and access to SRH services. Second, it would help you identify which social norms drive those behavior. And third, which are the key people influencing these norms and behaviors. And this information is what helps make programs specific to the context, and it improves really their future success. So in the past decade, there's been a growing recognition that addressing social norms is critical to achieving gender equality in reproductive health. And here at IRH, we've been at the forefront of advancing this research agenda. And through really successful partnerships with donors, such as USAID, the Bill and Melinda Gates Foundation, Save the Children, UNICEF, and many others, as well as with implementing organizations and local partners, all of whom have been using our work and applying our work to inform their programs related to SRH. Now, to conclude, think about if we had just one generation of adolescents who were able to delay child birth until they are ready, to continue school and to have healthier children. Just imagine how a country could be transformed to one such generation, right? And this is what we at IRH are helping to achieve in order to sustain improvements in adolescent sexual reproductive health and prevent violence. Thank you so much.